Some parts of West and Central Africa have continued to witness seasonal outbreaks of Mpox. Reports say Nigeria had the highest number of reported cases in the past. Recently, the World Health Organization, WHO, declared Mpox as a disease of public health emergency.
And rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
History has it that Mpox, formerly known as monkeypox, is an infectious disease caused by the monkeypox virus and was first discovered in Denmark in 1958 in the monkeys kept for research, while the first reported human case of Mpox was a 9-month-old boy in the Democratic Republic of Congo in 1970. Following the eradication of smallpox in 1980 and that of smallpox vaccination worldwide, Mpox steadily emerged in Central, East, and West Africa. Osun State epidemiologist Dr. Molola Adiagbe explained that the virus could be contacted through contact with fluids of rodents and some primates who are the carriers of the virus. She added that person-to-person transmission of Mpox can also occur through direct contact with infectious skin or other lesions such as in the mouth or genitals.
Mpox now, before we used to say monkeypox, but now we say Mpox because monkey, it is a bit confusing because people will say monkey, then it means it's actually from monkey. The thing is, one can actually contact Mpox from rodents, primates, and of course, you see, when I say rodents, something like even grass cutter, one can get Mpox from it. They are good reservoir, they are good host for that virus. And then how do humans get Mpox from infected animal? Of course, by not cooking, having contact with the blood of the infected animals. When we're talking about these infected rodents, those at high risk, you agree with me that hunters can actually be at risk of having contact with blood of these infected rodents, and also having contact with someone that is infected with Mpox can actually be another way of having it. When I say contact, I mean having contact with the patient's rash, having contact with the patient's fluids, even respiratory droplets.
Dr. Adiagbe explained that the common symptoms associated with the infection include rash, fever, sore throat, muscle aches, pain, back pain, low energy, swollen lymph nodes, among others. She emphasized that the rash begins as a flat sore, which develops into a blister filled with liquid and may be itchy or painful, urging the public to seek urgent medical attention in all the health facilities in the state.
Everyone that has Mpox we manifest symptoms. So it's important that when we see someone, just the way we prevent ourselves during COVID-19, if we have someone coughing, sneezing, and I told you part of the symptoms could be cough, let us make sure that we will never be able to overemphasize the role of hand washing, because whatever it is, we will have to pick it and then take it to our nose or mouth. So it's important to increase our hand washing and make sure we prevent ourselves from any form of and whenever we see someone that has symptoms that do look like Mpox, which is what I have said, rashes, some fever, which of course is there today, a day two, please let us encourage them to go to health facilities where we have qualified hands.
Latest report from the Nigerian Center for Disease Control, NCDC, announced that Nigeria has recorded 40 confirmed cases of Mpox out of the 830 suspected cases in the country. The agency explained that the cases are spread across 12 to 13 states, primarily in the south, south, and southeast regions, as well as in Lagos, Ogun, and some northern states. Osun State epidemiologist Dr. Adiagbe said Osun has not witnessed any outbreak recently, but the state government, under the leadership of Governor Ademola Adeleke, has taken proactive measures to nip the outbreak in the bud. She called on the people to imbibe hygienic lifestyle through regular hand washing with soaps and water, maintain social distancing, among others. Dr. Adiagbe affirmed that prevention is better and cheaper than cure. Oluchi Amuda for Dateline.